Hi, and welcome back to Your Autism Game Plan. I'm Joya Vanderlaan, a family nurse practitioner, a functional medicine specialist, and an autism mom. Today I'm going to go over the basics of something that you may have heard of called PANDAS, P-A-N-D-A-S. It stands for Pediatric Autoimmune Neuropsychiatric Disease Associated with Strep or Streptococcal Infection. So that's a mouthful, which is why we go by PANDAS most of the time. Now, what's the connection with autism here? Well, a lot of our autistic children, by their very nature, the autism diagnosis, some of them have overlapping symptoms with PANDAS. But with a strep-related autoimmune problem, we really want to get, again, to the underlying root cause, which is, in PANDA's case, the strep infection. Now, typically, PANDAS is very rare in the general population. OCD or obsessive compulsive disorder and those symptoms kind of tend to go along with PANDAS, and about 1 to 3% of the population has OCD, and about then up to 5% of those people, their symptoms are caused by PANDAS. Now, in the autism population, about 17% of individuals with autism have OCD-like symptoms or an actual diagnosis of OCD. And so, of course, then the number of those affected by PANDAS is going to be theoretically higher in the autism population than in the general population. I find it helpful to break down these acronyms and these mouthful terms before I dive into things like symptoms and treatments. So let's start by kind of defining each piece of this acronym. So the P is for pediatric, pretty self-explanatory. It's with children, with kids versus with adults. The A stands for autoimmune. Now, you may have heard of other autoimmune disorders like rheumatoid arthritis or ankylosing spondylitis or lupus, MS, multiple sclerosis, but you probably haven't heard of PANDAS. So autoimmune means the body, our own body, attacks itself because it recognizes our own cells, tissues, organs as foreign and therefore mounts an immune response to them. Our body should recognize our body's own tissues, cells, and organs as self and not attack. But when something goes wrong in the immune system, as with an autoimmune disorder, then our own immune system starts attacking our own cells. Something has gone wrong. N is for neuropsychiatric. So this has to do with mental disorders that are caused or related by different disorders of the brain and or the nervous system. D and A stand for diseases and associated with. I think we can skip over those. And then the S stands for strep or streptococcal infections. Now, we normally have streptococcus, different strains, varieties growing in and on our bodies. And that's normal and that's okay. Now, if the strep, the wrong kind of strep, grows in the wrong place, like in our intestinal system, in our mouths, in our throats, for example, we can get infections because of that. Now, if the wrong kind of streptococcus grows in our throat, for example, we may get strep throat, which you've probably heard of. Strep throat can be pretty serious. You know, we want to take that seriously, for one, because it can cause other organ systems to become affected and damaged, but for two, because now we know this can be associated with PANDAS. So if we kind of take all those things together and try to understand it as a whole, basically PANDAS is an acute onset disease. In other words, it comes on fast in children after a strep infection. As I mentioned, the characteristic, the hallmark of PANDAS is a few different things. First of all, that the symptoms come on suddenly. Second of all, it happens after a strep infection, about 4 to 6 weeks or so. It also is severe, so severe enough to interfere with this child's life, their functioning, and I'm going to kind of read a little bit of a list, and I'll post the list here too, so that you can kind of go through a few of the more common symptoms associated with children with PANDAS. They can be both psychological and physical. So some of the physical symptoms include tics or other unusual movements, sensitivities to light, sound, or touch, so some sensory issues, deterioration of small motor skills or handwriting. Their handwriting suddenly can become worse. Then there's hyperactivity or trouble focusing, memory problems. Big one is trouble sleeping. Sometimes, occasionally, they'll refuse to eat, and that can cause some weight loss. Sometimes joint pain, urination problems, bedwetting, leakage is quite common. And then some of the psychological symptoms. So I talked a little bit about this, but the obsessive compulsive behaviors, repetitive behaviors are quite common. Anxiety, fear, panic attacks in these kids. Sometimes things like screaming or just being generally irritable or having their mood change frequently, more frequently than normal in a child. And then there's the emotional, behavioral, and developmental regressions that can happen. So they're losing skills or they're sort of regressing back to when they were younger. And sometimes this can also sadly be associated with depression and suicidal thoughts. The child just kind of has real trouble. And you can imagine why. When you feel like this, that's not a nice feeling. You might be wondering, how is PANDAS diagnosed? Well, it's a clinical diagnosis, meaning that there's no one blood test to say, yes, your child is positive for PANDAS. You know, there are certain things that we can do, like test the brain waves, do certain blood tests, sometimes, measure different antibodies in the blood, sleep studies if the child is having issues with sleep. And of course, we want to make sure it's not something else autoimmune or inflammatory going on. And so very often it's kind of a process to diagnose PANDAS. There's a lot of things we want to make sure it's not before we end up diagnosing PANDAS. The treatment for PANDAS is usually threefold. The first is going to be treating the infection, so treating the strep infection for a few weeks usually. It's a little bit longer than if your child just has a simple strep throat infection. And then the second piece is modulating that immune system and that inflammation. A lot of times we'll use things like steroids or NSAIDs, so non-steroidal anti-inflammatories such as ibuprofen, Advil, for instance. You never want to use aspirin in a child, by the way, if you forgot that. And then the last piece is kind of medications for symptom control. So the child's having anxiety, you might want to have them consider some sort of anti-anxiety, or if they're having mood issues, mood stabilizers or antidepressants are very often used. Now, of course, my perspective is always to think about if there are good options for more natural treatments, and there are. Now, you want to work with somebody who's versed in treating PANDAS, because especially in this case, PANDAS is severe enough, and you really want to make sure that you are treating it the right way and completely. And so I would really advise looking at the MAPS website for a provider, a doctor, nurse practitioner, PA, who is experienced in treating kids with PANDAS and similar issues, because they're the ones who are going to kind of be able to give you the comprehensive, the integrative care if you're looking for that approach, and advise you on different supplements in addition to the medications. Thanks again for joining me. I hope this has provided you a little bit of information about PANDAS. The next video, I'll talk about PANS, which is very similar, but there are some differences, one in particular, and I'll talk a little bit more about testing and treatment and that kind of thing. So thank you again for your time, and remember, be gentle with yourself. You're doing a great job.